To our Health Watch, where we discuss all the topics trending in the medical world. We're sending things over to Tim Lammers with more. He is there in Studio 61 with Dr. Syed Hussain.
Who, by the way, is absolutely glowing right now. We heard the nice things, Erica, that you and Matt had to say about him a few minutes ago. So on behalf of him, thank you for that. He is very knowledgeable. We love having him here. Doctor, good to see you
Thank
again.
you. Likewise. Thank you.
Glad to have you here. Okay, we've got some bad things to talk about today. A new report from the Centers for Disease Control and Prevention found that the U.S. infant mortality rate rose a tiny bit, 3%. So not 3 percentage points, but 3%. Seems small, but is still significant, statistically significant, and a statistically significant jump for the first time in a while. What do we know about what's behind it?
That's right, Tim. This is the first we've seen this rate go up in about two decades, so 20 years. So more deep dive and drill down will be needed to understand the reasons. We do know we had, after 2 years of pandemic-related restrictions, we had an uptick in RSV and flu, especially in infants last year.
Yeah.
So that may be a factor, but there's a bigger story here and tied to maternal health. And we've talked about maternal mortality and complications a couple months ago, but maternal health and infant health are intertwined. So the data from the CDC actually indicates that maternal complications at birth have also gone up. Sepsis at time of birth has gone up as well.
Blood infections.
Yes, exactly. So all of those combined, point to a larger issue related to access. More data is needed as to which demographics are being impacted the most, so that we can have a concerted public health effort to go back in the right direction where we were. Now, it's still early, though, to say if this is a blip or is this something larger here at play.
But it would certainly make sense. Like you said, maternal mortality, infant mortality, it would make sense that they're linked. And yeah, it is very well established that the United States lags other developed countries when it comes to maternal mortality and health. Okay, colder months are here. Let's talk about some preventative measures. I imagine it's a lot of common sense, just ways to keep ourselves healthy and relatively virus-free to whatever degree we can.
That's right, Tim. So first thing I'll start off with is prevention. Prevention's always better than cure, right? So the two vaccines now for influenza and for COVID are available. CDC data from mid-October indicates very poor uptake in terms of COVID-19 vaccine in U.S. adults. So, please roll up your sleeves, get the vaccines, protect yourself and your loved ones. And measures that we've employed during the pandemic still work. So for instance, masks. You've heard it before, you'll hear it again. If you're in a crowded indoor situation, poor ventilation, where you can't really vouch for everybody if they're healthy or not, then masking is not a bad idea. Rapid tests, using those rapid tests before a gathering, for instance, or if you're feeling like you may have been exposed or developing symptoms, take 2 rapid tests 48 hours apart to have a more confirmatory diagnosis. If you're, feeling sick, then stay home. So common sense measures that have worked in the past apply now as well.
Yeah, and that is good to see. Regarding the vaccines, does it usually take a couple of weeks, just like the older COVID vaccines,
up to 2 weeks,
up to full effect?
Up to 2 weeks to kick in. So now is the time as the colder, weeks and months start. It's good to get those vaccines. Right,
you're going to want to get it in before Thanksgiving, and the idea here is just not to do it 2 days before Thanksgiving.
Right.
Better than nothing.
Right.
There's some ramp up, but 2 weeks is generally what we
Now, keep in mind, we still have 1,200 people dying from COVID every week in the U.S.
Yeah.
So, in my view, all of these deaths could be prevented. Mostly prevented. So especially in those individuals that are higher risk, age-related risk, as well as underlying medical conditions, they should get the new COVID vaccine.
Yeah. COVID's not going anywhere. It's not the threat nearly that it once was, but if it's still killing that many people in that short span of time, it's just something we're going to have to always take these measures to try to guard against, and that's what pretty much you're talking about. Thank you so much. Dr. Syed Hussain from Trinity Health of New England. As always, great to talk about preventative measures too, right, to stop some of these problems, Erica, before they blow out of control.
Absolutely. Good stuff, always.